Hello again, I'm Atabong, and this is the second video for my final assignment in this English for Registered Nursing course. And in this video, I am going to initiate a patient-nurse conversation, firstly about administering antibiotics intravenously to a patient, and secondly, I am going to provide home care instructions for a hysterectomy discharge patient. And lastly, I'm going to have a conversation about a I'm going to provide patient discharge instructions for a coronary angioplasty patient. Well, the intriguing part about this video is that I'm going to be the patient and the nurse at the same time because I couldn't get someone to play the role of the patient. However, I am going to make the conversation a bit well understood. I am going to distinguish when I am talking as a patient from when I am talking as a nurse. So it would be quite easy to follow. So let's begin with the first case. And in this case, I'm talking about administering antibiotics intravenously to a patient, and my patient here is Edward. So I'll begin as a nurse. Hello, Edward. I am Atabong, and I'm a student nurse, and I'll be attending to you during this shift. So your lab results are back, and you have an infection, and your current condition is that your body is exhibiting extreme reaction to this infection. But how are you feeling at this moment? Patient. Well, I'm just feeling quite weak and warm and dizzy. Nurse. Okay, yeah, that's the feeling when you have this kind of infection. Well, in this regard, I am going to administer to you antibiotics intravenously. But first, I would like to know if you've had any allergic reactions to antibiotics before. Patient. No, I haven't. Nurse. I will go ahead and administer the antibiotics intravenously, and it will come as drops over 1 hour. And I would like you to do this. What I would like you to do is to stay calm and relaxed in your bed while the infusion is running. And do you understand this instruction that I'm giving? Patient. Oh yes, I do understand. Nurse. I will come back to the I will come back to flush the infusion line after the antibiotics has gone through. But if you need any help during this time, please press the call bell and I'll be here to help you with anything. Do you have any questions at this point? Patient. Oh no, thank you very much for your help. Nurse, thank you and see you soon. So this is the first part of um, the video. In this second question, I'll be providing home care instructions for a hysterectomy discharge patient. It's quite a difficult word to pronounce. And it will be the same in this video. I'll be acting still as the nurse and as the patient. But of course, I will inform you in what capacity I am speaking before I get to utter the words. So, nurse, this is now me talking to the patient. So, nurse, you had a procedure called abdominal hysterectomy. It's a surgery to remove your uterus, and this can relieve problems such as severe pain and bleeding. It usually takes 4 to 6 weeks to recover from abdominal hysterectomy. And one thing I need to remember is that the recovery time varies from person to person. Patient. What happens when I get home? Nurse. Well, when you get home or before you get home, you don't have to drive until we tell you that it's okay to do so. And also, don't drive while you're still taking these opioid pain medication because they have some really strong side effects, which is not good for you to drive for your safety and the safety of others. Also, you need to ask help with your house chores and errands while you recover. Don't lift any heavy objects above 5 kilograms, and avoid sexual intercourse and other strenuous exercise for about 6 weeks. Don't vacuum, don't do housework or any strenuous activity until your healthcare provider says it's okay. Mm, Walk as softly and as comfortable as you feel able to do. When you must climb stairs, go slowly and pause for every few steps and take a deep breath and relax. Patient. What about the sutures? Nurse. Well, the surgeon used absorbable sutures, so you don't have to worry about coming back to take them out. They're going to dissolve in your body over time, so that's not going to be a problem for you. Patient. Should I expect any abnormalities or side effects? Nurse. Well, you should notice slight blood stain discharge, which will be normal within the first few weeks after operation, but any continuous foul smelling discharge should be reported immediately. Also, avoid intercourse, as I earlier told you, for maybe 6 weeks or up to 3 months if you can. Patient. How should I treat the surgical area? Oh, good question. Nurse. Oh, good question. Well, shower as usual. Wash your incision with mild soap and water. Don't scrub the incision to clean it. Pat it dry. Don't use oils, powders, or lotions on your incisions. Those are not necessary at this point. You just have to keep it clean. You can also call us right away if you have any of the following after the procedure as you get home. If you have high fever above 38 degrees centigrade, if you have high fever about 38 degrees, or you have chills, you have trouble urinating, or burning when you urinate, if you have severe pain or bloating in your abdomen, if there's some kind of redness, swelling, or drainage at the incision site, if you have shortness of breath or chest pain, nausea, and vomiting, please do call or visit us immediately. Do you have any further questions? Patient. Oh no, thank you. The instructions were quite clear. And thank you again once more for your help. Nurse. Oh, you're always welcome. And thank you. Hope you get well soon. Well, in this third part of my video, I am going through is the third it's the third question and the last for this final assignment, and I'm going to be talking about patient discharge instructions for coronary angioplasty, and it will be the same format for this video like it's been for the first two questions. So, nurse, I'm speaking now as a nurse. You just had a coronary angioplasty, and that was to stretch the blood vessel so blood can flow freely. Additionally, the doctor inserted a metal mesh tube called a stent in the blood vessel, and the stent helps the vessel to stay open throughout so the blood can keep flowing freely. At this point, you're being discharged. Do you have someone who can drive you home? Patient. Yes, my husband will be here shortly to take me home. Nurse. Oh, that's great. So when you get home, you rest for 2 to 3 days after the procedure. Well, most people are able to go back to normal activity within a few days. You would have to ask someone to drive you to your subsequent appointments for the next 5 days, and also you should frequently check the incision area for signs of infection, and you should do this every day for at least a week. And you need to take your medications exactly as directed. Do you have any further questions at this point? Patient, what if I discover that I am allergic to some of the medications? Nurse, oh, that's a good question. It's important that we talk about allergies because people are different and they react differently to different types of medications. But first of all, if you have any problem with any of the medication, please call us right away, or you can visit us here in person if you have someone to bring you. But it's easier if you just call and we can attend to you over the phone. And you should call us also right away if you are bleeding, but go to the emergency room if the bleeding cannot be controlled. By that I mean you should call the emergency services if you cannot control the bleeding. Patient, can I go swimming with my husband anytime soon? Nurse, oh no, don't swim or take bath for 5 to 7 days. Well, this is to keep the incision site from getting too wet and possibly infected until the skin and the artery around can heal. It's important that we avoid any form of infection because it could complicate the whole process altogether. However, you may shower the day after the procedure and try to keep the incision area as dry as possible. Do you have any further questions? Oh no, thank you. You're welcome.